Hi, my name is Celina Hwang, and I will be presenting on adolescent sleep and structural health gaps. I'm a senior at Austin Prep in Reading, Massachusetts, and I'm interested in neuroscience and global health. I have research experiences about microcystin removal technology, and I also have an ongoing research about adolescent sleep health and caffeine consumption. So why is sleep so important? We often treat sleep as a personal lifestyle choice, but it's not. It's biological and non-negotiable for health. Sleep deprivation contributes to a wide range of physical, neurological, and psychiatric disorders. It has enormous economic costs, and it deepens health inequities, especially for disadvantaged adolescents. First, health implications. Sleep duration is set as one of life's essential 8 factors for optimal cardiovascular health, according to the American Heart Association. Sleep is also a determinant of brain health, according to the European Academy of Neurology and the WHO. To talk more about neurological disorders, sleep is essential for memory consolidation. Sleep disturbances can lead to cognitive decline and increased risk of Alzheimer's disease. Sleep also has economic impacts, as poor sleep health can have financial costs of healthcare, workplace and motor vehicle accidents, and also productivity losses. There are also non-financial costs, such as loss of life quality and premature death. In the 2016 to 17 financial year, Australia estimated a total financial cost of $17.9 billion US and a non-financial cost of $27.3 billion US due to sleep deficiencies. Sleep is very closely related to health equity, as environmental and social determinants of sleep disproportionately affect disadvantaged groups of society. For example, factors like commute time and workload heavily affect the total sleep time, leaving certain groups of people at risk of poor sleep health. So I did a research on sleep in adolescents, where I surveyed 151 high school students across 22 different high schools in the greater Boston area. In my survey, 88.8% of the students in the weekdays and 40.4% of the students in the weekends did not get 8 or more hours of sleep, which is the recommended sleep time for adolescents. Also, 23.8% of the students had sleep onset latency, which is the time it takes to fall asleep, of more than 30 minutes, and 6.6% had a sleep onset latency of less than 5 minutes, which both indicate poor sleep quality. We also had an average of 6.37 sleep satisfaction score out of 10, and the sleep satisfaction score had positive relationships with both weekday and weekend sleep durations. Despite these alarming sleep patterns among adolescents, there is a significant lack of both research and policies regarding this matter. My data calls for attention and demonstrates the urgent need for evidence-based structural solutions to protect adolescent sleep health. One major factor that affects adolescent sleep health is the school start time. In my survey, 84.8% of the students said that later school start times will help them improve their sleep. Also, in a 2022 review article, it was found that middle school students obtained the 8 hours of recommended sleep when the school started at 8:30 a.m. or later. Also, those schools starting at 8:30 or later were associated with the best outcomes in adolescent sleep, behavioral health, such as improved mood and better cognitive abilities, and also higher academic performance. Video game exposure is another factor for adolescent sleep health. In my research, 53.6% of the students reported that social media and entertainment was one of the main reasons they did not get enough sleep. Studies have also found that exposure to a video game is linked to a reduction of total sleep time and an increase in sleep onset latency. Higher gaming volume was negatively related to fatigue, insomnia, bedtime, and rise time, with these effects being greater when gaming exceeded 60 minutes per day. Also, a study on U.S. adolescents found that the number of those getting insufficient sleep increased between 2009 and 2015, and video game use was positively correlated with failing to get 7 or more hours of sleep on most nights. This is a case study of a South Korean law trying to limit video game exposure for adolescents. On November 20th, 2011, the government of South Korea implemented a policy restricting adolescents aged 15 or below from playing online games after midnight. The restrictions were from midnight to 6 in the morning. This was implemented to prevent internet addiction and ensure, in theory, a sufficient amount of sleep. However, the policy was found to have poor effect and had largely failed to prevent internet addiction. And this result was actually consistent with the results of similar policies from other countries. The reasons why this policy failed was because it coincided with the popularization of smartphones among Korean teens, and it also failed to identify the root causes of sleep deficit, which is not solely about video game exposure. In conclusion, sleep is essential to the UN Sustainable Development Goal 3. Ensuring healthy lives and promoting well-being for all at all ages. However, sleep remains a deeply under-recognized and under-protected public health concern, especially for adolescents. Therefore, first, we need a stronger global research foundation. We need standardized metrics and a comprehensive and multinational datasets. Also, policies must catch up. We should implement later school start times, and also introduce effective screen time guidelines. But most of all, sleep should be recognized as a health priority by the WHO for countries to include sleep in their national health agenda. Here are my references, and I would like to thank Mrs. Chaewon for encouraging me to initiate my passion project and helping me with my survey, and also thank you, Dr. Song, for your guidance and support throughout my research journey. Below is my email, so please don't hesitate to contact me if you have any questions, and thank you so much for watching.